Okay, this should be the last video lecture in the chapter of middle childhood. And in this lecture, I want to talk about mental health, or as your textbook suggests, that maybe we shouldn't be calling it mental health, but we should call it emotional health. So I want to talk about some emotional health issues that show up or are concerning during middle childhood. Once again, middle childhood is elementary school, so it's elementary to adolescence, and there are some common emotional issues that show up. Their researchers suggest that there are some genetic influence. These things seem to run in families. A couple that you may or may not have heard of. One is called oppositional defiant disorder and conduct disorder. Now, some of these, if you were in psych, we would have spent a whole chapter talking about what it makes a disorder. But we're defining oppositional defiant disorder as patterns of defiance, disobedience, hostility towards adults that last up to 6 months. And this is the thing about anything that gets characterized as a disorder. There's usually a duration, and it's usually 6 months. And like you have to have this and this and this for a pattern of 6 months, right? There are some more specific. They argue, fight, blame others, angry, and often these kids have few friends, obviously. So, or logically, I should say, if you're going to get into a lot of fights. A similar one is called conduct disorder. So where the first one is described as towards adults, conduct disorder, does not specify that it's towards adults, but these are persistent, repetitive aggression or antisocial. Remember, antisocial is like the opposite of helping. Things like fire, truancy, and these show up early. So some of these patterns would not be considered disordered if they'd show up at like 14 or 16, but when they show up at like 6 or 7, then they would fall under these categories. Some other terms, we've got school phobia, separation anxiety, general anxiety disorder, obsessive compulsive disorder. And here's the thing, all of these are considered, and again, in psych, we have a whole chapter, but all of these are considered anxiety, which means, or anxiety disorders, even like all of them involve what would be called rumination. So the brain sort of repeats these same things over and over again. When ruminations create an irrational fear, we call it a phobia. So apparently characterized in this age group is a irrational fear of going to school. So a fear because there's bullies at school, or a fear because your teacher is mean, would not necessarily be an irrational fear. So the key here is that it's irrational, right? And that it impairs a child's ability or willingness to go to school or get something done. Separation anxiety is described as, I've not seen this in your textbook before, this one is described as this irrational worry about being separated from leaving home, or maybe being separated from a parent. Social phobia, social anxiety, is a kind of ruminating worry, difficult to identify the cause of. And in the psych textbook, we describe social anxiety as fear of being judged. So fear of being with people for the fear of being judged. Generalized anxiety disorder is a kind of chronic, low level, just this general sense that something bad's going to happen all the time so like social phobia is if you're not at school, you don't have that feeling, but this just general something bad's going to happen without an ability to identify the cause, or an ability to changing environments doesn't make it better. Obsessive compulsive disorder is like 2 categories, right? It's actually 2 things. It's an obsession, which is a ruminating anxiety, worry about something that compels you to act. So it's the obsessive thought that compels someone to do something, and that's the compulsion. So common ones, washing and checking. You wash your hands all the time, you check your pockets all the time. And then the way they work together is this behavior is supposed to reduce the anxiety. So you're compelled to check your pockets because it makes you feel less anxiety. And then depression, when we talk about it in kids, they use the phrase cause the inability to have fun. So depression is characterized by, your inability to concentrate, changes in your sleep habit, your sleeping, your eating, your weight. You may lose weight, gain weight. You may quit eating, eat too much. You may sleep too much, sleep too little. But it's this profound change. What apparently separates, like in an adults, it would be your inability to concentrate and go to work, and take care of your kids. But when we're talking about depression in kids, it's the inability to have fun, to have pleasure, to be a kid, right? Some common treatments. So we have lots of them, actually. There's individualized therapy, family therapy, behavioral therapy, art therapy, play therapy, and then drug therapy. Individual therapy is one-on-one, you and the counselor. Family therapy, which is what we did with our kid, and then where the family would show up as a group, like every third week, and then 2 days a week the counselor would work with my child. And this was my son, and my son, because he was a kid, he would use play therapy. So it's when a trained professional plays with a kid in a way that they can use play as a way to learn and to ask questions about their emotional health. Art therapy is the same kind of thing, except that's when you use art as a way to express your feelings, and then with a professional sort of observing or participating alongside, and then noting sort of the nature of the art. Behavior therapy or behavior modification, the only thing I can think of is in relevance to a dog. So I should actually have another word. Cognitive behavioral therapy is a kind of approach where a therapist works with a client to change the way that they think. So when they start having thoughts about, oh, I'm a bad person, I'm a bad parent, then you replace your thoughts. So the behavior is the thought, right? And you modify the way that you're thinking, because the idea is that your thinking influences your behavior, which influences how you feel. So if you can change the way you think, then you can change the way you act, or the way you think affects how you feel, which affects how you act. But the point is that you begin to modify the way that you think. You notice thoughts and you change it. Okay. Couple other concepts in here. You have the idea of resiliency. So children, in fact, are remarkably resilient. It means their ability to bounce back, their ability to maintain composure, or to continue to plug through. Children are quite resilient. What predicts a child's resilient may in fact be their genetics, right? Their temperament, which we talked about way back several chapters ago. In terms of small children, actually, like infants, one of the things that predicts their resilience is if they are easily calmed, if they're easily soothed. Because then a child, so going way back to a couple of chapters ago when we were talking about the colicky baby, or the child that had a difficult to calm temperament, right? If a child is easily calmed, then an adult will be more likely to pick them up and take care of them. So in essence, this promotes resilience. A kid who's difficult to calm, who is difficult to be around, who maybe has limited verbal skills, who maybe is not very attractive. These may be children that are less likely to solicit adults. So the key here is that a child's personality may predict how easy it is for them to get the attention of an adult. When they can get the attention of an adult because, I don't know, they're cute, they're charming, they're whatever, this acts as a protective factor for them. And then cognitive functioning, of course, is how well a child can solve their own problems, right? How can they articulate? How can they solve problems? How can they ask for help? How can they describe how they feel? And all those things then act as protective factors and make them more resilient to mental health issues and crisis and all of those other things. Okay, I think this wraps up this chapter. I feel like I've just talked really fast. There are a couple exercises in here. I think about maybe I have one in here about your friends when you were in school. Where did you go after school? Things like that. Thank you for listening.